Hi there, science fans. Welcome to another episode of Science and Other Stuff for Senior Citizens. My name is Dan Casciano. If you like these COVID-19 videos, please subscribe to my channel and ring the bell to be informed of future videos. In my last video, I discussed some good news associated with treatment of COVID hospitalized patients, vaccine development, and the determination that cellular immunity in exposed individuals may be more long-lasting than we originally thought. In today's brief video, I will be describing some of the health issues that are associated with susceptibility to COVID-19 and disease severity. I will also present some data that inform us of the decrease in immune function with age and data that inform us of the COVID fatality rate in the age groups more likely to die from the virus. Although these numbers are somewhat morbid, they are real and are meant to confirm the recommended data guidelines from the CDC for staying safe during the pandemic. In my next video, I will be updating where the science is regarding vaccine development and the progress with patient treatment scenarios. This slide is just a reminder of what the CD recommends for staying safe during this pandemic. Those recommendations include washing and cleaning your hands often, avoiding contact with sick people, practicing distance from one another at least 6 to 10 feet apart, avoiding crowds, especially indoors, and wearing a mask to prevent your and other exposures to COVID. This slide presents some of the health issues or comorbidities associated with increased susceptibility to COVID-19 infection and disease severity. Age is a comorbidity. Nearly 80% of the deaths associated with the infection occur in individuals 65 years or older. In the next several slides, I will describe the age groups and the probabilities of death as an outcome in each of these age groups, as well as the comorbidities associated within these age groups. Hopefully, these data will inform individuals of the value of following the CDC guidelines, especially if the relatively resistant individuals come into contact with the most susceptible of our population. Those who suffer from diabetes are nearly 3.7 times more likely to have a critical case of COVID-19 or to die. This fatality rate increases if the diabetic also suffers from other age-associated health issues. Those who have been diagnosed with heart disease or hypertension suffer more complications from COVID-19 than those with no pre-existing disease. Obesity, whether associated with another health issue or even in healthy individuals, has been identified as increasing a negative outcome from COVID infection. Some of these health issues are genetic and predispose one to susceptibility to COVID and other diseases. However, some are environmental or lifestyle and are preventable. This slide indicates the loss of immune function with age and some of the diseases that are associated with an aging population. The graph on the left depicts what happens in our immune function as we age. The orange line indicates this process and is a generic representation of data published in the peer-reviewed literature. As one can see, our immune function peaks in our 20s and begins to deteriorate into our 40s and achieves its lowest state during our old age. This graph depicts our average loss of function, however. Our genetics or lifestyle can either increase or decrease the severity of this loss. The graph on the right shows experimental data indicating specific diseases associated with the aging process. One can see that some of the comorbidities associated with COVID-19 susceptibility are also associated with the aged individual. However, from these data, we cannot distinguish the contribution of genetics or lifestyle or environment to these disease outcomes. For example, the COPD and cancer outcomes may be more associated with smoking than with genetic predisposition, or more likely both contribute to death in these age groups. We will see in the following slides that coronary or heart disease is a major contributor to COVID susceptibility. This slide presents data from February 1st 2020 to very recently that many of you have seen during the past 6 months. The difference is that these data are broken down by age groups. The red line is 85-year-olds or older. The yellow-green line, 75 to 84. The blue line, 65 to 74 age group. The red line, 55 to 64 age group, while the remaining show the 0 to 54-year-old groups. It is obvious that the most susceptible population are the 65 and older groups. However, it is also obvious that none of the groups are entirely free from the fatal outcome of COVID infection. This slide indicates the numerical data that describes the graphical data shown in the last slide. This table describes the age group identifiers, the number of deaths, and the percent of each group contributes to the total. Sometimes real numbers rather than graphical representations have more impact on behavior and whether one puts into practice the recommendations suggested by the CDC to reduce the number of deaths and the severity of the disease. However, these data are just numbers and don't represent the individuals or families who have suffered the worst outcomes of the pandemic. I further broke down the CDC information into age and conditions contributing to death by the COVID-19 virus. It is quite evident from this table the pre-existing disease most prevalent in these data are respiratory diseases and cardio or circulatory diseases. The numbers represent percent of those with the disease who have died with COVID. For example, in the 65 to 74 age group, 24%, or 1 in 4 individuals suffering from respiratory disease and died with COVID-19 were 65 to 74 years old. So I'd like to reiterate those CDC recommendations in this slide. It has been recently suggested that if these recommendations had been followed in late February and early March, approximately 82% of those who have died up to now may have been prevented. For more information about science, visit my website at www.dcasciano.com. If you have any questions or would like me to develop a video on a specific science subject, leave them in the comments below or email me at dan@dcasciano.com. Be sure to like this video and subscribe to my channel and ring the bell so you can be informed when I upload a new video. Thank you for watching Science and Other Stuff for Senior Citizens. Bye.